Sam, a Defence Force member has been injured overnight in Brisbane. It's believed it was during a G20 training exercise. A Black Hawk helicopter flew the injured soldier to a park at Windsor, where he was transferred to an ambulance and taken to the Royal Brisbane and Women's Hospital. 2,000 troops have moved into Brisbane showgrounds for the G20. The $15 million security deployment comes 9 days before world leaders gather in the city. Wednesday saw another protest against the G20 with a visible police presence. Meanwhile, one of the city's largest hospitals is warning patients, especially expectant mothers, of potential problems accessing medical help while the summit is on. The Mater Hospital is in Brisbane's declared security area. Its G20 emergency commander, Dr. John Gilmour, joins us now. Doctor, thanks for your time. Just what sort of challenges are you expecting for your emergency services over the G20 weekend?
Well, certainly working with Queensland Health and the police advice is that we can expect traffic delays or disruptions as they need to respond to the needs of the G20. So it's really a major priority to us to actually understand it's about access to the hospital.
Yeah, you've sent out a letter to expectant mums about getting to the hospital during G20. What's your advice?
Yeah, certainly we know that babies don't wait for anyone, so we deliver about 25 babies a day. So our advice to mums and dads is if they have any concerns about their pregnancy or are they actually birthing, they have a 24/7 number that they ring the hospital so they can talk to a midwife. Our next advice is if they're travelling to the hospital, they should allow extra travel time. And certainly working with the Department of Health, we've suggested that if we have a mum who's really labouring or actually in the middle of birthing, they really should be ringing emergency services to ensure they get them to our hospital.
Just out of interest, what extra resources have you added for that G20 weekend?
Certainly, we've actually staffed for really like a midweek activity, certainly in areas like birthing, emergency, those sorts of services. We've made sure that we've got staff on board. We even know that some of our private obstetricians have decided that they might stay over at the hospital over the long weekend to again eliminate that risk of them trying to get to the hospital.
Okay, all right, thanks for your time. I hope it all goes well.